This is an instructional video on the use of a meter dose inhaler and its administration from the patient perspective. When you go to the pharmacy and pick up your inhaler, it's going to come in a box like this. This happens to be albuterol, which is a bronchodilator, which will help open up your airways of your lung. So when you open the box, there'll be instructions in there as well as your meter dose inhaler. This is a canister which actually has the medication inside, and then you have the mouth portion here. Also, whenever you use a meter dose inhaler, you should be requesting, or the physician should have ordered, a holding chamber. Now there's two types of holding chambers. There's one that has, in this case it says here, anti-static. And the other type does not state that anywhere on the package. It's important that, or ideal, that you use an anti-static chamber. But in most cases, patients won't get that. They'll go with the cheaper inhaler, which is the non-anti-static. So why is this important to know? An anti-static prevents the medication from adhering to the walls of your chamber until it gets well coated with the medication. So if you use an anti-static, it's not going to happen. That means the medication is actually going to get to you. If you did buy a holding chamber that is not anti-static, then when you get home, you need to wash it in warm soapy water and let it air dry. That coating of that soapy water will prevent the molecules of the medication to adhering to the wall, and then you're ready to go. Okay, so now let's go to the inhaler. The inhaler, since I just took it out of the box, needs to be primed. And so what we're going to do, whenever you're going to use your inhaler, you're going to shake it up. And then, since this is my first time using this inhaler, I'm going to squirt it. This is known as priming the inhaler. With this type of inhaler, albuterol, and the propellant that is in here is an HFA, which requires at least 4 pumps to fully prime it. Now it's ready to be used. If all you did was take it out and use it, you would not be getting any medication. Okay, so it's very important to prime it. Now, there's also another caveat to this, that if you don't use your inhaler for a couple of weeks, 2 weeks, you will need to reprime it when you're ready to use it after shaking it in between. So with the use of a holding chamber, we're going to take the mouthpiece portion and put it on the back side of your holding chamber. It should just fit right on in. And then the mouthpiece here, we're going to take the cap off. And now we're going to exhale all the way out, emptying our lungs. I'm going to put this in my mouth and then take a slow breath in as I actuate the meter dose inhaler. And then I hold my breath for 10 seconds if I can. And then I blow it out. So you would do this the number of times that is prescribed by your physician. And that is how you use a meter dose inhaler.